Give me the bullet.
Charging 260.
8 units of ONAG down here, stat.
Let's shock him. Hit the sync switch.
Let's hook him up to the external pacemaker.
Multiple gunshot wounds to the neck, chest, abdomen, and legs. Intubated, tension pneumo on the right. Gave 2 liters of saline, needs a thoracotomy and a laparotomy.
Call respiratory for a vent. Call radiology for a chest film.
What I think is unique about ER is the commitment to technical realism. And that's something that hadn't been done before.
It was such a realistic show. You know, this first sort of semi-documentary television show I've ever seen.
Get a head CT, CBC, Chem 7, LA, run up blood sugar.
BP's down to 60 over nothing.
You were going behind the curtains of an emergency room and seeing things that you'd never seen before.
Dopamine, 400 milligrams and 500 G5W. Let's get a cross-table C-spine, then a chest. Let's order a head CT non-contrast.
We all really wanted to master the medicine and to have the medical community look to our show as the most authentic medical drama that had ever been on television.
Almost there.
Chest normal.
Could be retroperitoneal.
Everybody had to be intelligent or able to play intelligent, and you had to be able to talk the talk.
Yeah, bolus and 3.5 mg of esmolol, and let's do a transesophageal echo to check out the damage.
It was hard, just with the dialogue and stuff, memorizing the lines, and then just making it look like it was just nothing.
I remember Eric's first day, he had to do we were doing this long shot that went through every room in the hospital as he's giving me a tour.
Chemistries are marked with these slips and left at the front desk. Mark everything stat, whether you want it fast or not.
And we had a joke that lasted for years where we'd go like this because it took Eric 22 takes to nail that shot. And so when my big bullet came, I made sure I knew it so cold that I could rattle it off to you right now.
All right, come on, give it to me quick.
65-year-old male with severe peripheral vascular disease manifested by
claudication of the left calf, 10 days post-op for Mercy General after having an aorta bifemoral bypass. No real post-operative course till about 6 hours ago.
And began to experience the gradual onset of lower left quadrant pain without palliative or provoking factors.
Here's BP 120 over 80, pulse 112, respiration 68. Upon auscultation, diminished breath sounds were noted at the base of the patient's right lung. Intrigued, I tested vocal fremitus probate second edition, leading me to a diagnosis of pleural effusion confirmed by this radiograph which shows fluid in the patient's right costophrenic sulcus.
Mother's maiden name?
He's joking.
We all felt completely out at sea.
He's not breathing. Start pulmonary suction. Laryngoscope.
I remember distinctly the first time I picked up a laryngoscope. And it was like, what the hell is this?
If this is the collarbone here,
It's an inch below
you go
it.
like an inch below the collarbone.
The medical consultants on the show saved the show because, it doesn't matter how many times you trail a nurse, you're not going to know the exact way to hold a needle or how to, inject something or do CPR.
Snap this together with authority, and that'd be something to practice.
We felt from the very beginning is that it should be accurate because whether we like it or not, people get their information about health from television.
Give her an amplified carb IV push and then put 2 amps into that leader.
The psychological sense that you have when you're working in an ER is it's really going fast.
A lot of blood coming out of his mouth.
So that's the sense that I was trying to make sure we got.
We would divide up every episode and we would write pages and pages of medical dialogue and how to integrate it into the show.
Response to pain.
Pupils are equal, round, and reactive to light.
For every minute of technical medical work that you see on the television set, there was probably 40 hours of pre-production just to be sure that it would come off quickly and without a flaw. So it starts with a script, and every scene of the script would be broken down by me, meaning that every prop that's needed, every makeup effect that's needed, every special effect that's needed. And once that's done, then you can meet with the director and give the director a sense of what's going on in the scene, because the directors don't have a medical background.
When I would rehearse a medical sequence, I would sit with Lance Gentile and Joe Sachs, and I would go over these sequences and say, what the hell's going on here? What does this mean?
Once the director kind of has a sense where people should be in the room, then it's up to the medical technical advisor to choreograph the trauma scene.
Now you're going to be taking a blood pressure on the side, so you guys are going to have to fight for position next to him, and that'll be a nice shot, actually.
And by choreographing the trauma scene, that means what is everybody in the room doing at every moment to make it look like the real thing. This is what the medical choreography looks like for 30 seconds of a trauma scene. This is everyone who's in the room, and this is what they're doing at every moment of the scene cued to the dialogue.
I paid a lot of attention to the detail of these procedures so that they looked seamless, because then the actors had to learn how to hold the instruments. And in the very beginning year, just getting their gloves on was kind of funny.
Our technical rehearsals would take hours. It'd take so long to get everybody up to speed. Everything was very alien. Every medical device, how to do a shot, how to get a blood pressure, all of that stuff.
Grab with those clippies.
Hydraulic engine.
So it just raised the stakes for everybody because no one wanted to screw up. So the concentration got very intense.
CO's present, both samples. Carboxyhemoglobin.
The language was more difficult than the procedures. Sometimes I'd write it down phonetically on a clipboard, but I was really bad at that. I pretty much have to know exactly what I'm saying because I get distracted at trying to look at what it is.
What do you got, Doug?
Okay, Mark, we have a 5-year-old with known coarctation of the aorta. She had a sudden onset of severe respiratory distress.
George Clooney pretty much cornered the market on knowing how to write his lines down on all the gurney sheets. He got in a lot of trouble the first year when people said he's always looking down. But he was beautifully reading his lines off every gurney going by.
A 16-year-old, bullet to the carotid artery, treading pulse, blood in his lungs, you're going to need to clamp it.
But I think there was one time that the sheet got a little too bloody from the trauma, and the prop department had to change the sheet, and no one told George. So, of course, we went to roll camera, and George came waltzing into the room and looked down to a blank sheet, and it was pretty funny.
The medical language was really brutal.
BP 70 over 50, pulse is 45, possible bleeding in the brain, GCS 6.
We did a 13-page oneer, and that was one where it ended with me saying the word supraventricular tachyarrhythmia, which I've never gotten wrong since then because I didn't get it right once when we shot it. I kept saying, can I just say a really fast heart rate?
Laryngoscope? Get a couple of IVs started.
So we have ET2?
Yeah, perfect.
A point of pride the prop department always had with this show has been the fact that everything that we're using is correct and accurate and is exactly what they'd use in the real medical field.
Okay, now you have blood refill. Remove the syringe.
Will do.
And feed the guide wire through.
We did a lot of research. Every time we turned around, we were watching tapes. We had medical books that we read. We looked at everything. We would go to watch real procedures in hospitals.
Give me some more lidocaine.
Where's he bleeding?
Our prop people became very astute at medical jargon and material and machines and whatnot, and they could probably take out your appendix now, these property people.
This is what we call the pericardiocentesis needle, but as is typical, our actors don't actually like getting poked, so we have these types that don't hurt so much.
Okay, clamp. All right, bag him.
Whenever we have a preemie, we create them.
And it's hard to make them look so real and to get their proportions right so that when you first pick it up, it is realistic.
BP sky high, 170 over 120. What about anesthesia?
We would really try and do all the betadine and swabbing and getting everything right, because with that hardness and trying to do dialogue, we became interesting characters to watch.
I think the biggest compliment that the show gets from doctors and nurses who really work in emergency departments is that they'll say to me, you know what, I can't watch the show because it's too much like going to work.